Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a renowned obstetrician and gynecologist, Dr. Sunanda Kulkarni. Her father was my professor, Dr. R.H. Kulkarni, a great teacher. So Sunanda has followed her father's footsteps and she has become a professor. She retired as the head of the department of prestigious Bangalore Medical College. And after retirement, now she's working in Chinmaya Mission. Apart from that, as a hobby, she's been a prolific writer. More than 500 articles and books she has written, and she has been there on the radio talks and televisions. And her passion is to educate the people and bring awareness among them. So, welcome, Dr. Sunanda.
Thanks for giving me an opportunity.
Yeah. I would like to ask you a question. The woman means the uterus because her motherhood is because of uterus. But many times the indication for that is not known, and irresponsibly or irrelevant hysterectomies are done. The uterus is removed. So, what is your opinion about that? Please let us know.
If you compare the Western countries, definitely it is more in our country because in Japan, UK, USA, it is less. And in our country, some states it is more. Example, Telangana, Chhattisgarh, Andhra Pradesh, and then part of this one, Rajasthan, Punjab. In some states it is more. So why it is increasing? There are two reasons. One is the patient herself. See, patient thinks white discharge means if you remove the uterus, that is the end of it. Okay. So you will not get cancer, you will not get white discharge, you will not get any tumor which arises from the uterus. That's what they think. So it's a myth. So we have to tell them it is our mistake that we should tell the patient that white discharge it is not from the uterus. It is partly it may come from the uterus, but mainly from the vagina and part of the cervix. So cervix is the opening of the uterus. So it comes from there. So white discharge is not the it is not the cause of it is not from the uterus. So we have to educate them. That is one. And then they think they will not get cancer and all that. See, and they undergo this hysterectomy. Now they don't know the value of uterus. See, one is when you remove the uterus, and if you don't remove the ovaries, still ovaries work for few years. And see that the hormones which are secreted from the ovary, they act on this lady. So these hormones are necessary. Number one is for her psyche because there are estrogen receptors even in brain. And then that's one. Another one is the bones become weak. So estrogen is necessary. So we deposit like a bank deposit the up to 30 years the calcium in our bank. And we
I
go
would
on
like
with
to
the
add.
time.
I would like to add one more thing to that. Not only for the bones and for the thing, even for prevention of the heart attack. When the estrogen levels come down, the divine protection for the women for the heart attack also is there. See, that is also very important. So preserving the ovaries and the hormones is very important for other diseases also. Okay, please go ahead.
There is a in Hindi they say आपने हमारे मुंह से बात छीन लिया.
Okay.
I was about to tell the other advantages. So if after hysterectomy, they get hot flash. So otherwise also they may get around about 45 to 50. In our country, the age of menopause is around 47 to 48, and in Western countries it is more because our we are Caucasians. So they are Caucasians, we are combined. So that's why the hot flash, everything. When they are young, only they lose their bone strength, and then see when they are young, husband is also young, and sexual life it interferes with their sexual life because when you remove the uterus and cervix, see the cervix also take part in the sexual act. Some secretions will be there. So and then they get vaginitis, and then vagina shrinks. As a result, they feel very difficult for the sexual act. So they may not, harmony in the house is lost.
Okay.
So not
Oh, I
only
see.
the bones become weak, and they will also suffer this menopausal syndrome, and they in the harmony in the house is also lost. So
Okay.
many things they lose with that. That's why when you get natural menopause, that is okay, because you may get a little bit when you remove by surgery, it is more, isn't it?
Okay.
So
Okay.
natural menopause, it may be a little bit less. That's why,
Hmm.
and so, all may not get. But here you, when they are young, only you are removing, so they will
Okay.
suffer. That's why it should not be removed. So in olden days, the days means when I was young and you were young, that time there were not many tablets or many this
Treatment options.
in ops, yeah. So that, and then many new inventions have taken place now. So new drugs are have there are there, and then we have this like a copper T, we have LNG, IUS, so many things. So we can reduce the incidence of the hysterectomy. We have to
Okay.
educate them. The only
Okay.
thing is we have to educate them. If you get hysterectomy done, then these are the problems. And
Okay.
what is the alternative? If you tell them, then they may agree. Only some people, they get scared that if uterus is there, then I may get cancer. We have to tell them that all will not get cancer. Nowadays, for cancer cervix, there is a vaccination.
Yes.
Okay. And then once in a year, anyway, you have to go for checkup. That time you can get the checkup of the from the gynecologist. So you
Okay.
need not undergo the hysterectomy. That we have to educate them. So partly it is from the patient, and partly from us also.
Okay.
So because we are not making awareness among the people, and busy doctors are there, so they one after the other they go on seeing, no time. So these radio talks and TV talks, they and then writing in the magazines,
Yes.
they help the patients.
Yes.
So that is, for endometriosis, adenomyosis, all that, and then the small fibroids, you can use the LNG IUS, and then
Okay.
if there is a heavy bleeding, there are strong tablets now, and you can put this one also. So with that, it is subsided. So the indication for hysterectomy are decreasing
down.
nowadays.
Okay.
So only thing is we have to be aware, and then we have to make awareness among the laymen.
Okay. Suppose a young girl comes with a severe colicky pain, abdomen, then there is a bleeding. What are the possibilities and how do you treat them?
Colicky pain after what?
The severe abdominal pain, the young woman has come with the severe abdominal pain and the bleeding. What are the causes and how do you treat them?
Now, if the young woman comes, now she may be very young. So in the and then or near menopause also. So if they one is in the younger age group, this fibroid develops. Okay, and then if she's very young, one more possibility is there, that in adolescent age.
Endometriosis. Okay.
Adolescent age I'm talking. So that time sometimes they may get severe the pain. So uterus, there are two uteri in intrauterine life. They join together, they form the uterus. Now
Okay.
sometimes what happens, this may remain separate and this is connected to the vagina. So
Oh.
sometimes bleeding may occur in this.
Okay.
Okay. So that can cause pain. So that's one reason in
Okay.
if she's young. And sometimes if she's young, the vagina is there, from the uterus, the blood comes through the cervix, through the vagina, and then it comes outside. Now sometimes there may be a septum in the vagina.
Okay. Okay.
So or there
Almost
may be solid.
obstructing the
It may
blood
be
flow.
so it will. So what happens? Every month she gets pain, and the uterus goes on enlarging. It accumulates the blood. So it is called as hematocolpus, hematometra, like that. So that in a
Okay.
very young age. So these are the reasons. And a little bit older, then in that case she may develop. Now uterus wants to produce something.
Okay.
If she gets married and if she gets children, it will be satisfied. If she
Okay.
gets married, if she
Okay.
doesn't get married, even if she gets married, no children, then uterus wants to produce something, it will produce
Okay.
the fibroid. Okay.
Oh, I
Uh-huh.
see.
So that's why
Okay.
it is more common in nulliparous.
Okay,
Okay.
okay. So uterus is, it has to produce either the lovely babies or disease. So better to have babies than have the fibroids or the other
Yes.
diseases.
So it
So
produces.
beautiful, yeah. Now, do you have the
No.
medicines or any other thing options other than surgery?
That's why I told you I think you are asking regarding fibroid.
Endometriosis. Endometriosis. You said the young girl, coming with the
Ah,
pain, and the
ah.
moment you give them medicine, she is relieved.
Yes, there are medicines.
Yeah.
There are
Okay.
medicines. They can take medicine every day. Then it will subside. And then if it is adenomyoma, means in the uterine musculature itself there will be blood clots. So
Okay.
in that case, you can put this LNG hormone containing IUDs, and
Okay.
with that it will also subside. So
Oh, very
you
nice.
can reduce the incidence of hysterectomy in
Okay.
adenomyosis, endometriosis, and even in fibroid. So if
Okay.
there are small fibroids, and fibroids already I have told, if by hysteroscope and laparoscope it can be removed.
Okay. Okay.
And heavy bleeding also you can use the LNG IUS. With that,
Okay.
the DOB and all that you can be in those cases hysterectomy can be reduced.
Yeah, thank you very much, Dr. Sunanda Kulkarni. It's very clearly you have told uterus is meant to have it. It is meant for our health, and it is to give protection and good hormones from the ovaries. And removal is not an answer for any bleeding or pain or any indication. So you can decide and make the precise diagnosis and give the specific, accurate treatment without removing the uterus. Thank you very much for your kind explanation to our audience. Thank you.
Thank you.